Friends, I'm saddened to report that over 100,000 Americans lost their life to an overdose in 2021. That's up from 93,000 in 2020. The good news is there are many who do recover. But how can we reduce the number of overdose deaths in our communities? Part of that answer is through harm reduction, a topic I know a little bit about and hence was provoked an interest in learning more. Just what is harm reduction? According to the Substance Abuse and Mental Health Services Administration, harm reduction is a proactive and evidence-based approach to reduce the negative personal and public health impacts of behavior associated with alcohol and other substance use at both the individual and community levels. My guest today is deeply passionate about harm reduction and says, quote, "Harm reduction is my jam," end quote. Sarah Laurel is the executive director of Savage Sisters Recovery Houses in Philadelphia. She also spends a lot of her time on the streets of Philly, extending harm reduction practices and outreach to those with substance use disorder. She holds training sessions for how to administer Narcan, which is a nasal spray used to reverse the adverse effects of an opioid overdose. She has presented in Harrisburg and on the local level advocating for harm reduction. She's here to discuss what harm reduction is and why we need to do more to raise awareness and reduce the stigma associated with it. Sarah, welcome to You Are Not Alone. I am so thrilled to have you here today to talk about this very, very important topic.
Thank you. Thank you for having me.
Glad you could be here. I just want to dive in. We got a lot to talk about, but maybe you could just give us a little bit of background of your experience and what led you to do what you're doing today.
Sure. So where do I begin? I had an experience with substance use disorder. I worked in the corporate field and was given a prescription for an opioid. And when that ran out, I experienced several years of some really traumatic stuff. I landed myself homeless in Kensington and suffered a physical trauma. I was in a wheelchair.
Wow.
And when I got that, actually ushered me into my sobriety. And I decided that at first I wanted to just create a safe space for women to recover in. And that started our first sober living house, the first Savage House. And then as we've grown over the past 5 years, our street-based outreach efforts were there so that I could go back and serve my friends who were still housing insecured and dealing with substance use disorder.
Wonderful. That's great. I tip my hat to you for doing this work. It's a huge passion, I'm sure, that you have. So when it comes to harm reduction, I've learned just with chatting you a little bit, it takes on a broader base of knowledge than maybe what the average person would know, including myself. I don't really have a ton of knowledge about it. So maybe we can talk a little bit about what is harm reduction.
So you gave a great definition of what harm reduction is. For me, we are trying to reduce harm for people who are engaging in some high-risk behaviors. It can be a myriad of different things. Harm reduction can be education-based. Mm-hmm. It can be housing. It can be safe syringes. Mm-hmm. It can be access to mental health resources, sandwiches, or just clean socks. Mm-hmm. You're literally meeting individuals exactly where they're at in a judgment-free space and offering them the supplies that they need, that they advocate for themselves, and providing personal autonomy for the individual to say, I need socks, or I need a sandwich, or I need safe housing, and then trying to help navigate them through that journey.
Mm-hmm. Okay. And so you mean like education? In what form when you say education?
There's a huge stigma around substance use disorder, alcohol use and misuse and abuse. And I think it starts with the education. People don't understand. Right. There's a lot of misunderstanding around this disease in particular, and the effect that it's having on the entire communities that we live in. So getting to the root of that would be education based. And in my opinion, it needs to start in the school system and with the youth so that they can understand that this is a disease and that there is help out there and how to respond if you are in a position where somebody that you love or are in connection with is experiencing substance use or abuse or misuse. How to respond, what resources to give to them, and especially if you come across somebody who's experiencing a potentially fatal overdose, how do I respond to that? Because all overdoses are preventable. If the community is armed with the tools to respond, we can lower that number dramatically. Stigma is there because it's taught, and it starts in the home.
I can attest to that. I can definitely understand where that's coming from. It's a stigmatized disease of shame, embarrassment, and I've said this before, something of a moral failure on the part of, you or your child. What did I do wrong? I hear that a lot from parents who have children who are struggling or who have lost their child, as I have. So I agree with you, the education piece at an earlier age, and to change the narrative of this disease, that it truly has become known that it is a disease just like any other chronic disease in our society, like cancer, like diabetes. And, we respect, I think we have a higher respect for people afflicted with those diseases as a society than we do with those who have the addiction, the chronic addiction, substance use disorder. So why is it so important that I think the stigma around substance abuse is there, but also the stigma, what people think harm reduction is. We all have our own picture, and why is it so? I think I'm going to go to like the harm reduction centers that I think they're trying to instill in different communities.
Well, I think understanding harm reduction on a grander scheme and a zoomed out lens is important, because if you zoom in on each individual resource that harm reduction advocates for, they tap into different demographics. And in a very typical media way, we hone in on the one that we can point a finger at and say, I don't like that one. And so as a whole, people judge harm reduction because maybe they don't believe that a safe consumption site is good, or they don't understand the reason for it. That's where education comes in, and having those open dialogues. For so many years, for decades, we've had this drug war and this prohibition, which historically speaking, prohibition has been ineffective. And if we want to get literal with it, there are safe consumption sites in every city. When you walk down the street and you get a specific measured drink from a bartender, and if you overuse, you will get your keys taken. And if you drive while under the influence, you will have legal ramifications. That is safe consumption. And it is done by the government, but it's harm reduction. And I think that stepping back, like I said, and zooming out and seeing that there are different avenues for harm reduction. There's education, there's direct resources for people that are housing insecure. And then there's the incredible need for reducing the rate of infectious diseases that are being spread for individuals who are going to behave in high-risk behaviors. They can do it as safely as possible, or they can do it without those resources. And the cost of a syringe is 10 cents. The cost to treat an individual for the government that has HIV is over $1 million in a span of a lifetime. So you can look at it from whatever angle you want. It's definitely a human right, in my opinion. It's public safety, and at the same time, it's financially responsible for the community and the taxpaying dollars.
Absolutely. Well, let's talk a little bit. I mentioned in the intro, one other form of harm reduction is Narcan. And since I've been more aware of a little more harm reduction, and I've gotten more educated, I do carry Narcan, and I encourage anybody to have Narcan on them. because I've said this to kids that I've spoken to. I've talked about Narcan. I said, I could walk out of a grocery store in Chester County and somebody could be keeled over, and I don't know if they've overdosed or if they've passed out for some other reason. And, again, it's part of harm reduction. This could help save somebody's life, and there wouldn't be any type of disciplinary action for me if indeed the person was not an overdose. Can you expand on that a little bit? And you teach the administration.
So one of our biggest things is overdose reversal training. And with the numbers as high as they are, over 100,000 people who have died, those are preventable. Our goal is to flood the cities with Narcan because it's very apparent that individuals are using, and some of them are unaware that they are even consuming fentanyl, because this fentanyl lacing is affecting individuals who are not just chemically dependent or addicted to a substance. It's also affecting individuals who use recreationally, situationally, socially. So what we're trying to do is show people these are the signs of an overdose, and this is how you can save a life. That's somebody's son, that's somebody's daughter, somebody's mom or father. So if you can take the hour-long training and carry that Narcan, use it for somebody. And the other thing about it is we want to empower individuals in their homes.
Sure.
In the state of Pennsylvania, 7 out of 10 overdose deaths happen in a home. So people are literally dying in the comfort of their own homes because nobody is aware of what's going on and or just doesn't understand how to respond.
Right.
And if we knew a little bit more, if we had those harm reduction trainings and we talked about it in a judgment-free space, so many people would have an opportunity to recover.
Now, a good point that you made about the overdoses happening in the home. I mean, somebody could have a legal prescription for an opioid for recent surgery or chronic pain, whatever a doctor could prescribe. Are they giving out Narcan with an opioid prescription in Pennsylvania? Are you aware of anything like that?
Not that I know of. There is supposed to be a standing order at pharmacies where you can walk in and request it, and your insurance can be billed for it, or there's a small fee for it. But there's also tons of places, even in Delaware County. I know Sarah Senko is the naloxone manager for the county. So anybody who resides in Delaware County can reach out to her and get free Narcan.
Yeah.
Which is incredible.
It is great. I've seen it more and more. A couple weeks ago, you had a booth at the walk that I attended, Teach One, Feed One. And here you had a dozen boxes of Narcan that anybody could just take. And it was great. I think it's becoming more accessible in communities. And I think it's so important that, again, it could be a young person, elderly person, like you said, anybody who may be consuming an opioid, to have this safety net. I mean, you could have an elderly person perhaps getting a hold of their medication and not realizing that how much they took, or if they took too much, and put themselves into an overdose.
Absolutely.
So important.
For somebody who drinks regularly, recreationally, and then has an injury and consumes an opioid pain prescription medication, that could really increase their likelihood of potentially overdosing. And the good thing is Savage Sisters will ship it to your house anonymously too. We respect your right to privacy. Not everybody is comfortable, reaching out in public and saying, I need Narcan, but we can ship it to your house, and you can just at least have the safety net of knowing if something happens, I'm prepared to save a life.
Sure. A girlfriend of mine picked one up that day at your table, and she actually was going to give it to her son, who is in college, and felt like it was important for him to have this in the apartment that he's living with. Maybe not necessarily for himself, but like you said, just to be equipped as part of a first aid kit. For this.
One other thing about students that are in college, and we've been doing Narcan trainings at fraternities and local universities to empower those students to be able to respond, is that there is a Good Samaritan law in Pennsylvania. And I know that there's a lot of fear around somebody potentially overdosing and not wanting to get in trouble with the school board or the police. And you are covered under that Good Samaritan law that you will not incur any kind of legal ramifications for contacting if there's an illegal substance present.
I was actually trying to remember that term earlier when we started talking, right? The Good Samaritan law, which is wonderful, and because that will encourage students or anybody to not be afraid of it and administer it and not be worried that they're going to get into trouble. Let's talk a little bit then about the Narcan and the reversal of an overdose. What's happening? I think there needs to be more of awareness of what's happening with some of the street drugs out there, and it's not responding.
Yeah, so
the Narcan.
For the last couple of years, we've had, and Trank Dope, it's called Trank Dope. It is specifically xylazine, which is an animal grade tranquilizer. And it's been in the drug supply in Philly for several years, but in the past 2 years, it's completely dominated the heroin supply. It's now in every single bag that's being tested in Philly. And I believe that the majority of individuals who come and they reside in Kensington and they use drugs and they are housing insecure, they're aware of the poisoning and the drug supply. But for individuals who maybe live on the main line and they drive to Philly and how we say cop and roll, they might not be aware of it. And so when we do our Narcan trainings now, we are really focusing on what that xylazine is. Xylazine does not respond to Narcan, so you should still do regular Narcan, but increase the rescue breathing. I've had to do rescue breathing for 11 minutes before somebody began to respond. I administered 3 doses of Narcan. However, the tranquilizer, they're asleep. And it's very resistant to the work that you're doing. 11 minutes isn't a really long time, especially when you're in that crisis situation. But we just encourage people, do not do chest compressions. It is not helpful. It is not the same as CPR. Do tilt the chin back, pinch the nose, 2 strong breaths, and then count to 5 and continue that for as long as you can until EMTs respond.
Okay, good, really good information. And that leads me into testing your stuff, as you have nicely coined it. Testing your stuff. There are people, like you said earlier, who do partake in recreational drug use.
Absolutely. We've found fentanyl in a myriad of different substances, from marijuana to pressed pills. Especially around college campuses, people can buy pills such as Adderall, Xanax, and they are pressed with fentanyl. Also MDMA, mushrooms, cocaine, all of those different substances have been tested and have been laced with fentanyl. So we are distributing fentanyl test strips as often as we can, so that if people are going to engage in consuming a substance in any way, that they can test it beforehand. The majority of individuals that we're trying to get in, that we're trying to reach out to, aren't chemically dependent on a substance. They're using situationally. So they don't want fentanyl-laced drugs. And a lot of people who do use a substance don't realize that it has fentanyl. If they test it beforehand, they can, number 1, go slow, or number 2, completely just like get rid of it and not use it, because it is so dangerous. And then on the off chance that they will consume it, we suggest that they call the Never Use Alone hotline. If you're going to consume it with the knowledge that there's fentanyl present, there's an 800 number that's completely anonymous. They will just get your location, and if you're non-responsive for a certain amount of minutes, they'll send EMTs to your door.
And what's that called?
The Never Use Alone hotline.
Never Use Alone hotline. Okay. Good information. Very good information. Okay.
So we really try to be like the anti-DARE program.
Okay.
Abstinence-based teaching is ineffective and can be really harmful. So Savage Sisters is just trying to reach out to the community, whether you're drinking and it's damaging your body. Over 99,000 people died last year from alcohol-related deaths, whether you're consuming recreationally or you're chemically dependent on a substance. We're here for you in a judgment-free space to offer you the tools and resources that you need to stay alive. And that's the main goal. Absolutely.
Absolutely. Fabulous information. I've been hearing lately of, I mean, new to me, probably not new to you, or maybe not new, and but it's new to me. I've been hearing about kratom, Delta 8. What are these? I guess they're drugs. What are they? Can you enlighten us? Because we had a situation with a store trying to open here locally.
So over the years, I think everybody's kind of aware that there's these weird designer drugs that will hit the stores and the community, and the youth are very negatively impacted by it because there's not a lot of studies or facts around those specific substances. But they're always designed to mimic a different substance.
Okay.
So K2 spice, that's supposed to mimic marijuana. It's not, it's a chemical compound. Kratom, it mimics the same, it hits the same receptors as heroin. You become chemically dependent on it within 72 hours of using it.
Wow.
And the detox is literally mirroring heroin detox. The issue with it is, number one, it's being sold in local stores, in kind of marketed towards children in like gummies and chocolate caramels and soda. So people could ingest or consume this in a way that they're not aware that it's a potentially dangerous substance. Not everybody will be negatively impacted by this substance, and people have used it for pain management and things like that. But there is always the idea that somebody could very negatively be impacted, and once they become unwell, they get sick from detoxing unknowingly, could it lead them to opiates?
Right.
Because it's hitting those same receptors. So we can't keep it out of the city. We can't do the abstinence-based teaching and say it's bad, okay?
Right.
We have to talk about it.
Right.
We have to inform the parents and empower the students to know what it is.
Right.
I think that if they knew how potentially dangerous it could be, some would err on caution. And the other big thing is that if you are experiencing these detox symptoms and you don't know what's wrong with you, it could lead you to other substances. Treatment centers, hospitals, they're not testing for it. You could overdose on it and people don't know what's going on. So it's here. We can't hide from it.
It's not going anywhere.
Let's talk about it.
Right.
And let's just be aware so that you can look at your kid and be like, okay, these are signs.
Sure.
How can I offer resources to help? So I think we need to talk about it. Delta 8, all these things, they're available within our community.
Wow.
Just as much as alcohol is available, and every single one of us drank in high school. And we all know about it.
Sure.
But nobody's talking about these other deadly substances.
Until a storefront tries to open up, and that's fine. I mean, maybe that was a good thing to open people's eyes and become aware. You don't know what you don't know till you know. I mean, I know for myself. I mean, Delta 8, kratom, trank dope. I have not heard of these until very recently. And the fact that a retail store had tried to open up, maybe that was, again, a good thing, a good sign that we're opening our eyes and being aware of these things and starting to talk about it. So that's all good stuff. Well, you're doing a great job. Tell me more now. Savage Sisters has 5 women's houses and
6. We have 3 women's and then we have 3 men's.
Oh, okay.
So our men's program is called SIR, which is for Savages in Recovery. And then we have the 3 women's houses. Our houses are the only houses that offer free dual diagnosis trauma therapy from a private practitioner. Kickboxing weekly, yoga weekly, and different holistic healing opportunities. Our residents don't pay for it, and we don't charge insurance.
That's wonderful. That's great. I just wanted to make sure that we know, that the guys know that there's a place in your network as well.
There is.
Although you started Savage Sisters, there's the Savage Sirs as well, which is really important. That they be aware that you have those services available for them as well. And you are a nonprofit, correct?
Yes, we're a 501. We got our status in 2019. And if we've just been doing the work since then. We started in 2017, but since we got our status, we've been able to really serve more individuals and access better resources.
That's great. That's wonderful. You're doing great things in Philly and in our outlying communities, and even at the Harrisburg, at the Capitol. You've been really busy with a lot on your plate, all for a good cause. And you mentioned something about this PUSH initiative, and I think that's wonderful. Is there anything a little bit what you can tell us about that?
Yeah, so PUSH is People United for Social Healing, and it is going to be a Delco pilot program. We are working on getting some harm reduction education at a high school and college level, and we're going to work with a really great team and collect some data to see how the information can positively impact the community and empower the youth.
That's great. That's great. I'm excited about that, about everything you're doing, but I'm really excited to follow this initiative, because I think it's very important that we get this information to our youth and to the parents of the youth to get a better understanding of all this that's going on. This has been wonderful. Well, we've covered a lot of ground and so much great information, and I can't be happier. And thank you so much for being here. But if people want to get a hold of you, reach out to you, get Narcan, get help, they're struggling, learn more about what you do or make a donation, how can they access you?
So they can go to the website, savagesisters.org, to make a donation or join us for outreach. We have all the contacts are located on the Contact Us page. If they want a Narcan training, they can email me, Sarah with an H, at savagesisters.org. And all my contact information is on the website. We're really easily accessible.
That's great. That's wonderful. I so appreciate you being here. And I think maybe we'll have you come back to talk more about some of these other things that you're involved in.
Thank you.
Thank you so much. Thank you for joining us for this important discussion. I hope you have gained knowledge and insight about harm reduction, what it is, the importance, and the role it plays in reducing substance use disorder deaths. I know I have. This has been wonderful. I'm Brenda Shavito, and remember, you are not alone. And if you or a loved one needs help or would like to donate, please visit us anytime at angelsagainstaddiction.org. I believe that together we can help save lives. Thank you.